when we talk about marginalization, right? Like for any community to be marginalized or considered a minority, it comes with an additional stress. So when we're talking about minority stress, we're talking about how circumstances in the environment of a person can lead to certain mental health outcomes, right? And that's mediated and moderated by a lot of different variables. So if we look at somebody having a minority status, then suppose I live in a difficult environment. I'm not out to my family. I'm living with a certain level of secrecy. I don't have too many friends who can, you know, um, who I can be authentic with. So there's a certain sense of shame and guilt which is developing internally for me based on the circumstances of my environment. Add to that a minority status in terms of something which is not as um, easy to access information on, or it's not as prevalent, or doesn't have as many markers or as many heroes to look up to, right? I don't have too many things that negate or that in any way mediate this shame and guilt that I'm developing. What that in turn leads to is that it starts creating um, stress processes for me. So, as a minority individual, I may experience discrimination, I may experience violence. If I'm a college going student, I may have um, classmates who bully me for being a certain way, um, relatives who make fun of me for not having had a girlfriend or a boyfriend so far, friends who tease me about different things. So I'm facing all sorts of violence and harassment in my environment. Along with that, I'm also um, trying to reduce this for myself, right? So I'm trying to keep all of this at bay because all of this further aggravates the guilt and the shame that I'm feeling and the lack of authenticity with which I'm able to express myself. So I start developing an expectation of rejection. There is that much less probability that I'm likely to go ahead and make friends with a person that I'm not friends with in class, because I assume everybody will react the same way to me. um, there is a natural level of concealment which starts developing. And there is, I mean, the model uses the term homophobia, but now we use the term homonegativity, where we all grew up in a certain societal structure where we ourselves, despite um, knowing better, despite understanding better, sometimes have internalized homonegativity. For example, if somebody says a certain term to me, I may react very um, aggressively to that or shamefully to that, that, I can't be labeled that. That's not a good word for somebody to use for me. So we also come with our own ideas of it's not okay for me to be a certain person. What then that leads to is that when, as my identity forms, it starts internalizing some bit of these stress processes. So I may come out to myself and say, like, okay, this is what the reality is, this is how I feel, this is who I am. And but still have that concealment with other people, have the added pressure and the stress of having to continue that concealment with other people, with a much bigger cognitive dissonance now, because I don't know if I slip, what happens. And all of this gets moderated by what is the sort of coping that I individually possess, as well as what is the sort of social support that's around me. So um, if there's more risk. Suppose I feel that if I was to somehow be outed in college, then my mother's a professor in the college and she'll definitely get to know. The risk becomes that much higher in my mind, and it keeps adding to the stress experience for me. So, what started as an issue of circumstance and of environment where we were saying, like, I know who I am, I'm just not able to share it with others because I don't have a great environment, now becomes even more problematic because there are all of these additional variables. And then what is the sort of community and individual support we get? Suppose I make that one friend who I'm able to be authentic with, that person who I'm able to get to a place where I don't have to conceal. It leads to very different mental health outcomes than for the person where they don't have that sort of support, where they don't have access to community, where they don't have individual coping mechanisms because um, the variables so far have been so unsupportive. So, a lot of what we talk about as, so I know like very often there are these studies which talk about, if like, um, and even the DSM till a degree used to pathologize this and would say that, if you are LGBTQI plus identity, then you are more, then you are likely to be depressed. It predisposes you to depression. That's not how it works. There are all of these variables in between which actually make me succumb to depressive symptoms. It's not my identity per se, but my experience of that identity in my environment with people around me, as well as internal processes within me, which have developed over time vis-a-vis the environment, which determine these negative mental health outcomes. So when we're dealing with somebody who, you know, um, identifies as LGBTQI plus identity and has maybe come to you with anxiety, it's not necessary that we sort of look at our DSM and say, yeah, okay, there is 30% more probability that they're likely to have anxiety. So yes, this is anxiety disorder, and we can do away with things, because that's not going to lead to complete, uh, you know, distress relief for this person, because there's all of these additional variables in this which is actually causing that distress. So as health service providers, as psychologists, that's people who are party to helping this person feel better, we have to also understand how we can help this person navigate these processes better so that they don't feel the negative mental health outcome. And if we start conceptualizing the problem this way of the individuals that come to us, we may be able to help them have more long lasting and actually holistic changes. So, yes, like lived realities are a very big part of how we go about negotiating what are going to be our mental health concerns.